Thank you, Dr. Siminovitch, for a really enlightening presentation. Little pun there, Gina.
Illuminating, I would
Yes.
say.
Yes. Welcome, Dr. Siminovitch.
Thank you.
Thank you. Good to see you this morning. We have a bunch of questions for you, and I don't know that we'll get through all of them because I think it was very stimulating to a lot of our viewers around what to do with this information. So I'm going to start off with a question from someone who says, I'm still using old incandescent bulbs, but once those bulbs run out, I'm not clear on what kind of lights to get and how to know when I get to the store whether something really is the right light for the usage. You know, they say lumens and they say, you know, give other measures, but will the lights talk about amber spectrum and other things like that? Is that kind of information out there, and what kind of choices should we make?
Yeah, it's an excellent question, and it's one that many people face. And actually, incandescent is actually a pretty nice light source. Unfortunately, it's not very energy efficient, and we've made it go away. And so in California, interestingly enough, the California Energy Commission regulates the lamps that are for sale in the state of California. And UC Davis was instrumental in putting together the color spectrum specification for that, which required a much broader spectrum than you might get with an Energy Star lamp or a lamp you might buy in Texas. So at first level, the lights that you can buy in the hardware store or in the grocery store, by law, are actually pretty good. They have a broad spectrum, and they're required to produce 2700 Kelvin, which is a slightly reduced color temperature, because we were very concerned about the melanopic content in the home. So at first order, it's not a bad choice. More sophisticated approach with the idea of introducing amber lighting is going to require a little bit more homework. And some of the suggestions that I made in the video, including things like amber intervention under the bed or in the bathroom, are really good sort of first techniques. And so I would look at those commercial technologies. Additionally, you can go to my website, and there's lots of information there, and you're more than welcome to send me an email, and I can be more specific on products. But that's basically the three levels of intervention I would consider.
So this piggybacks a little bit on what you just mentioned. I think there's just a keen amount of interest in knowing what is available at this point in terms of making the adaptations. And so are these something that people are moving piece by piece, bulb by bulb, strip by strip, in terms of both the nature of the light, the amber tones for evening, et cetera, and then also the energy efficiency where it's dimmable or sensor driven? Is this something that's pretty clearly marked for consumers to go out and purchase? Does it take a lot of sleuthing to find that combination?
Yeah, again, it's a great question, because it's something that's very timely. Again, I think the sort of the standard lighting that we all expect to see and are used to see, it's available today. And so when you go into a hardware store, you have a pretty good level of trust that you have an energy efficient, good color, good spectrum light source. But understand it's a very standard approach. The next level, which is sort of more circadian sensitive, which would look at the idea of introducing an amber spectrum and in conjunction with sensors, requires a more sophisticated approach. And again, there's a good, better, best kind of approach here. There are technologies, inexpensive, that you can introduce amber in your bedroom today and in your bathroom or in your hallway. And they're available through commercial outlets. You can purchase an amber-based system for your bathroom, bedroom, hallway, and you can plug it in, and you can get to the next level. So this is on top of the standard lighting that we're all used to. The more sophisticated level is the amber. Now, we're learning new things, and there's a good, better, best. There's a best solution, which is requiring very high level of tuning and spectral tuning and controls, something you might see in a hospital or in a healthcare clinic. And that will be where we'll see it first, and then that will get gradually reduced to home usage. But there's very good solutions today that you can put in inexpensively. For less than $100, you can instrument your home with a good amber spectrum.
That's great.
So, you know, a lot of people are worried about things like seasonal affective disorder, which is often treated with light.
Yeah.
Is a circadian healthy home, you know, a kind of a thoughtful lighted home prevention for seasonal affective disorder? Or in your opinion, is the bright light that's used in the mornings for treating seasonal affective disorder the right way to use light?
Yes. I mean, this is the way I typically look at this problem is it's what we're doing in the evening, which is really hurting us. And it's all the light disruption, it's the computers, it's the excessive light. Living room level lighting today is not good for us. And we've got the numbers on that. And so I worry less in California about suppressing melatonin during the daytime, because people get outside and you get enough circadian entrainment just walking out to the car, out to the parking lot. And so we worried less about this, but certainly for the homebound, for the people that are, say, in hospitals or in healthcare, or you know, elderly people that don't get out, we're concerned about seasonal affect because they're not getting enough light. Some of the, you know, some of the assisted living environments are in tune on this, and they understand that they need to move patients into sunrooms or into spaces that are exposed to more light. You know, like the old TB wards that we saw in the 40s and 50s, where people were put into conservatories with lots of light as a healing. They knew something then. They knew that people needed to be exposed to bright light. I'm not that worried about circadian entrainment in homes. I'm more worried about the light at night. I think that's much more damaging.
So can I just follow up on that? So would you say that it's not an issue of having too little light in the morning, but having too much light through the evening?
Yes.
Is that correct?
It's what we're doing. It's what we're doing at night that's really hurting us. Because I think entrainment happens, and we see this a lot with students. You know, we're concerned about appropriate circadian environments. Students are sort of the what I call the canary in the cage, because what they're seeing is enormous circadian disruption at nighttime, but they're walking around campus all day, so they're getting lots of entrainment. And so we really need to be mindful of what we're doing at night. We need to solve that problem first in California. Now in Canada or in Northern Europe, yeah, you know, these people are living in the dark, and so we need more light inside our spaces. Our offices don't have enough light, and we've spent years and years reducing light inside offices for energy purposes. We need to rethink that.
Yeah, interesting. What is your thought about light therapy and its uses? So you just mentioned related to light exposure for seasonal affective disorder, and then you showed the work that you're doing, the studies you're doing around amber light for stress reduction in students specifically. Are there other uses that you're looking at related to light therapy?
Yeah, it's a really great emerging area, and we all know. I mean, seasonal affect, lots of devices, lots of interesting science on people sitting in front of bright lights that don't have enough light. And again, certainly we've understood that in people who live in northern climes, you know, that they sit in front of bright lights, and it's basically you're entraining your circadian system. Lots of arguments about how long you should do that. I mean, some people are arguing for very short periods, some people are arguing for very long periods. I think the stress mitigation, which we think is not hormonal. There's something else happening because the effects are instantaneous. So we're using that. There's lots of very interesting work coming out on red light and infrared light. And slightly different things. There's stuff on infrared and also on far infrared that we don't see, that's actually having an instantaneous and pretty profound effect in different areas. And we're working with a university in University of British Columbia, and they've done some very interesting work on sort of far red for therapy. And so we see this as a next big opening. Now, I have to say, United States energy organizations and in California, we've done almost everything we can to eliminate red. You think about low emissivity glazing on windows. So what we're doing is we're cutting out a lot of red. So children inside schools aren't getting enough, as much red as they used to get. The light sources, the fluorescent sources especially, were basically anemic, almost no red content. Light sources outside of California are very anemic. And that's the thing about incandescent. Incandescent has a lot of red in it and has a lot of red that we don't see. And it might be, unfortunately, that starts to get into people think that it's energy waste. It may be, but it also may be very important for us.
Mhm.
So there needs to be another examination of what is that infrared component doing for us, and it could be quite a lot. Yeah, it's great. It's a great. So this is a whole new area of therapy that's opening up to us.
Yeah.
So, we have a number of questions that have come in about people with visual impairments or disabilities, color blindness,
Oh.
the need to, only view things in low light, or older people who feel like they need bright lights to be able to see. What are your recommendations?
Yeah. So very simply, first, we need a broad spectrum of light source. And so particularly for the color challenged individuals, including 10% of the boys that are listening to this, right? It turns out that 50% of all women are tetrachromats, meaning they have 4 broad color sensitivities, because the information for red and green is carried on the X chromosome, and women, because of the genetic drift, get 2 doses of that information. There's people looking at this, and this is, lots of folks have said, well, girls are very good at, fabrics and color and textiles and painting. So there might be a genetic predisposition that allows women to have broader color sensitivity. Now, this is being looked at. But sort of back to the question. First of all, broad spectral distribution. We need rich broad color. The University of California, Davis has adopted a 90 CRI specification. And all that means is that we have a broad spectral requirement. Outside of the university, everybody is starved for color, unfortunately, and we need to change that. Certainly with our aging demographic, we need more light as we get older. And this competes against the regulations we have for energy. We're constantly reducing power density requirements for lighting, which means reducing light levels. Now, I'm starting to wear glasses. I can't read the newspaper anymore, and I can't read the back of the vitamin bottles anymore. And I wonder if I ever was able to do that. But we need more light, and it's a very simple equation. More light, better visual acuity. But it's more light and more what type of light for the elder population. Turns out high color temperature or bright white light, you get smaller pupil size. And with smaller pupil size, you have higher visual acuity. And as you get older, you get more junk in your eyes, and you get this thing called blue light scattering, and you get more glare. And so we need to be cognizant of sort of the glare conditions. Older people often get misdiagnosed of, oh, they're confused. It may be that they can't see, and it may be very simple kinds of things like this. So we're not cognizant of this. So we need to do a better job of this. We sort of recognizing the requirements of the older population. I mean, we're all moving there rapidly. And there's many things that can be done as very simple interventions.
Another population that had a question related to shift work or night shift workers. Any recommendations that you have relative to light in that population?
So we have actually a project on this, and this is the whole night nurse issue. So if you think about a night nurse, they go in and they're working at night, which is now their day. And so what does the hospital do? We're quieting down the hospital. Light levels are coming down. Lights are being turned off. Everybody's going into sleep mode, except for the nurses who are working. And if you go into nursing stations, many nursing stations at hospitals at night, it's very dark and it's very subdued and very respectful of patients. And I get that. but they're not getting enough circadian entrainment. And a lot of this early circadian design and circadian research was built on the high levels of problems, disease, et cetera, associated with shift workers and nurses. And nurses have all these sort of higher elevations of all these disease problems. And part of that for sure is due to this significant circadian disruption. So they need to have entrainment. So we're looking at actually at UC Davis of putting in daylight spectrum lights in their nursing stations, so they are subject to bright white light that separate from the patient. So like a sunroom at nighttime. So that's good for a homogeneous cohort. In other words, if everybody is working that way. But unfortunately, shift workers, they have all kinds of strange schedules. The second part of this problem is our shift workers go home to sleep during our day, and they're confronted with lights, televisions, daylight pouring through windows, all kinds of disruptions that we don't normally have at night. So I'm recommending to people who have shift work is you need to have a appropriate sleep architecture, and you talked about this. Blackout curtains, best investment you could do, full blackout curtains. And so we're recommending that you just keep extraneous daylight coming into your space. So shift workers, if it's kind of a continuous kind of problem, I think can be managed relatively easily by getting appropriate entrainment during the day and appropriate darkness at night. I can read a newspaper by the street light coming through my window. You know what I mean? And so you can imagine what shift workers do when they come home. They've got, so it's about managing this kind of environment. But Davis is starting to get in front of this, I think, with the nursing stations and starting to really understand what to do. It's a great question.
So one last question for you before we close out this excellent section. That we're building a new hospital, and I know that you've been involved in some of that. We're trying to be more light sensitive or enlightened. And can you talk a little bit about what the plans are and the thought that has gone into some of that?
Yeah, so we were, we evolved the circadian protocol, and we worked with the design team, and I think in the patient rooms, on the hallways, we worked with the nursing people, and a lot of those recommendations we pulled through. Now, you never get everything, and so I think that we've made some really good steps forward in terms of in the patient rooms, color change for daytime, nighttime, and then an amber layer for nighttime navigation, and then some of that in the hallways, and we're looking at the nursing stations, having this kind of entrainment capability. So we think we're going to get most of that, and again, there's trade-offs on cost, but most of these interventions are very low cost. And actually, on the stress mitigation, we're doing this, the stress mitigation in the radiology labs at the UC Irvine. You think of going in for an MRI, just how terrifying an MRI is. So we are putting in amber lighting just as a standard protocol inside the MRI spaces at UC Irvine. And I'm trying to sort of push that forward at the hospital here. The results were too late for the first generation, but I'm persistent, and we're going to try getting that in there.
I know you are, and I want to thank you for a fascinating discussion today and for joining us.
My pleasure.
Thank you very much. Have a great day. And this is going to conclude our scheduled talks for this morning.